some of the initiatives that we've started. CTI kicked off in January. That's critical time intervention, which is related to transitions of care, which we know are so very important to the people we care for. Coming home from the hospital, making sure that they have everything they need. Rapid response, new system. Definitely had some bumps in the road early on, but very optimistic that this is going to be a game changer for New Hampshire, having this one number, especially when 988 comes on board. And then also inpatient care. And you have seen, New Hampshire is in the process of purchasing Hampstead Hospital, making sure that we have secured children's services, inpatient children's services for the long term. We are building a forensic hospital to make sure that our civilly committed people and patients do not have to be in a correctional environment, but in a clinical environment at a hospital. And then also trying to make some pretty steep investments in inpatient behavioral health beds in the southern part of the state. So we're coming at it from all sides, the community base, the crisis base, and inpatient base. So I hope you all stay with me through this journey to get us where we need to be. I've said this before publicly, and I'll say it again, that change comes from within us. It doesn't come from the government. It doesn't come from the department. We can all be leaders in that change, but it has to come from the community. It has to be every one of us individually. So that's kind of my update on mental health. I do have some prepared remarks, which I rarely can ever get through without going off topic. So bear with me while I do that and try to stay on topic a little bit. So hold on to hope. Such a great title. I love the title of this year's conference. Hope is a word that when applied by an individual can take on a myriad of meanings. It is in essence what a person desires or dreams of. Think of some examples related to the people we serve. I hope someday to not need to worry about accessing care. I hope my therapist doesn't leave. I hope someday that depression doesn't control my life. I hope to have stable housing. I hope to have meaningful employment. I hope to live independently. Our hopes and the hopes of the people we serve guide us as mental health professionals, give us purpose and direction. I will remember, and I will always remember, a certain patient at New Hampshire Hospital. After taking the CEO role, I received a message from this long-standing patient requesting to meet with me. During rounds the following day, I made a point to visit her. And this is a summary of what she said. I know you just got here and you're busy. I've lived here for 15 years. It is my greatest wish to someday live somewhere other than here. Doesn't have to be anything special, but just not here. The staff here are great. They take good care of me, but I do want to leave. I hope you can help me. Her hope was her dream, and she was asking me to help her make it happen. It took almost 3 years, but it did happen. It is still today one of my proudest accomplishments of the things that I've done at New Hampshire Hospital and probably in my career as a nurse. What is remarkable is that she took action on her hope. So often in both our personal and professional lives, we never get beyond hope. Oftentimes the steps between hope and action is saying it out loud. When was the last time you stated your hope out loud with the intent of it leading to action? If you are surrounding yourself by the right people, they will immediately want to help you make your hope a reality. If I was in person right now, I'd be going around the room and I would be asking you about your hopes. I am notorious for picking people out of the audience and asking them to speak ad lib. But since I can't do that today, I'm going to share some of the hopes that I've heard, some of the things, some of the hopes that I have myself, and hopefully you can all relate. I hope that someday every person will have access to mental health care in their community by their community. Who else wants to help me with that? When you say this out loud, this inspires people to want to take action to help make that hope a reality. I hope that the professional fatigue and the extreme burnout in our healthcare professionals caused by lack of resources and COVID pandemic will recede, and we will all find a renewed energy and passion for our work. I hope that by next year, every person experiencing a crisis with mental illness will not need to spend a single night in the emergency room. And while we are all working on those professional goals and trying to take those hopes into action, I will say that as a family member and someone that is the primary caregiver for someone with mental illness, I hope that I am enough. Through the years, I've heard that hope from families and caregivers countless times. We want to be enough until the system catches up or until the gaps in our system close. It's a lot of pressure, hoping to be enough. I've not only heard it in mental health when I worked in long-term care, I've heard it from adult children taking care of elderly family members, frail parents. I've heard it from single moms trying to hold down a job and take care of her kids. I've heard it from people like me that are their person's person. I am my person's person, that he calls me at 1 a.m. when there's anxiety, when there's crisis, when there's depression. I've heard it from all caregivers, just hoping to be enough. Now, that transition of hope to action is a winding path that requires us to be nimble and flexible, steadfast, stubborn at times. I am known for that, and it's okay. Sometimes people call me stubborn, and I wear it like a badge of honor at times, because sometimes you need to be stubborn to take those actions, to make those changes. But it does require us to ask for help. NAMI New Hampshire is a great example of an organization that takes the hopes of the people we serve and transition them into action. Our 10-year mental health plan is a transition from hope to action. Their work in the peer support area is hope to action. The crisis intervention team for law enforcement, that is hope to action. We do not want one more law enforcement shooting to happen in New Hampshire. This is how we take our hope and make it a reality. One area that we have hoped to impact for years is around eliminating stigma. Although we have used education campaigns and awareness campaigns, it is time for us both individually and professionally to take action on this item. This action starts with ourselves. As I've said earlier in my presentation, is that change does not come from government. It does not come from the commissioner. It comes from all of us. It comes from personal experience. It comes from the community. It takes every individual person to make minute or large changes in how we see things or how we talk about things. If we are the guardians of equality, specifically for mental health and access, then we need to hold ourselves accountable to the words we use, the judgments we make, and our internal bias. We have all unknowingly and without ill intent used words that proliferate stigma. Think about words that have been around forever: loony, crazy, nut house, asylum, all of those words. Our own New Hampshire statute on the definition of insane, and I'm going to read this to you, at least part of it. The New Hampshire statute on the definition of insane shall include every idiot, non-compos, lunatic, insane, or distracted person. I get angry every single time I read that. And if, believe it or not, when I had taken action to try to change this definition, I got pushback. No one in mental health would want this definition, and it shouldn't be on our books. We need to change that. How do we expect to change stigma when the very words we use cast judgment? We need to start with us. Personal responsibility. Let's make a commitment today. Let's turn hope into action. Let's choose our words carefully. That we have opportunities on a daily basis to restate things that are clouded with judgment and or even around world events. Just look at the people in the public eye. And all of these are, we look at our celebrities and the politicians and our news anchors and all the people in the public eye, and there's a lot of pressure being in the public eye, and I get that. But think about people in the past, where as a mental health professional, you sat back and went, that person really needs help. Think, Britney Spears and Lindsay Lohan and Amanda Bynes and pretty much everybody on a reality TV show, right? You've seen those people that are cast in their roles because of some of the behaviors that they exhibit in the public eye. I'm sure everybody last week heard about the slap around the world at the Oscars. People were abuzz. I saw it all over social media. That's crazy. That's insane. He lost his mind. This is what I saw. I saw a traumatic event for Chris Rock. He showed resiliency, but I hope he gets help to process that event. That was a traumatic event. He was humiliated on national TV. And then you see Will Smith. Everybody talked about violence and aggression. I saw a man with a broken spirit. I saw a man that waited too long to receive help for trauma, serious life events, pressure, expectations, and stress. There will be memes and there will be Saturday Night Live skits. 4 years poking fun at that event. And it was traumatizing for one participant and the embodiment of a broken spirit for the other. It is not something that we should poke fun at. This is no way excuses the actions or the consequences to what happened. Every person that cared or does care for a person that had been shattered to their core saw more than a slap in that event. There is not another ailment or disability that we as society would accept making fun of. Not a physical ailment, not a developmental disability. None of those disabilities would ever be the topic of an SNL skit or meme, because we would be outraged. And we need to be just as outraged when we see that type of poking fun at people that are having serious mental health problems or just a breakdown. This is my call to action. See beneath the surface of those actions. Choose your words, choose the things you look at, choose what you share on social media, understand the impact of the behavior, and make an individual choice to change how we talk about people that are in mental health distress or having crisis. Whether that be celebrities, people in society, people in the public eye, people locally, people in our family. Let's just change the way we talk about it, change the way what we consider acceptable. So for my prepared remarks, thank you so much for listening to me talk. I am happy to answer questions if there's questions in the chat, or if anybody wants to ask questions verbally.
So if folks could put their questions in the Q&A, that would be great. Commissioner, I do want to tell you, I don't know if that you probably weren't able to monitor the chat when you were speaking, but I think particularly when you talked about your hopes, that really resonated with folks here. And so thank you. I think I was making notes of some of what you said too, and then I saw the chat was similarly happening. So thank you. I'll give folks a moment to pose some questions. You mentioned early on in your remarks the state's purchase of Hampstead Hospital. Any updates for us in terms of where that's at and because I realize purchasing Hampstead Hospital doesn't necessarily mean you suddenly have a lot more people to open those beds. So I guess love to hear about your plans for how we might expand that access.
Yeah, so we're hoping that the purchase agreement goes through in the next 4 to 6 weeks. It's interesting because when we buy a house and we think, it takes 30 or 60 days to close a house, closing on a hospital is so complicated. And it definitely took longer than we anticipated. Hampstead, we have a strike team in Hampstead right now. We will be increasing their census from 40 to about 55 in the coming weeks. We expect that so we will continue to increase census there. And then our goal in the first 6 months is to open a PRTF for youth and adolescents in that hospital. We will be subcontracting with a private provider to provide the care at Hampstead, the clinical care. We will have a leadership in that is state run. And they are working with the staff at Hampstead right now to put them on their payrolls and to transition them over. And then also be recruiting out of state, so I think that it's an uphill battle for workforce right now. And I think getting some new blood in our state is going to help dramatically, especially those people that have the ability to recruit statewide or countrywide.
So, and that's always very encouraging, because we worry, of course, about when we say we're going to expand it, we're going to move folks around their seats and not have expanded capacity there. I think we did have a question here. You made reference to the PRTF, and I think someone's asking for you to explain that acronym.
Sure. PRTF is Psychiatric Residential Treatment Facility. It is the level of care between acute and long-term residential for youth and adolescents. So, we try to keep acute care for children under 7 days. That is what we did at New Hampshire Hospital when we ran the kids unit there. It's what Hampstead tries to do. But there are generally kids that need longer term stay, think 60 or 90 days. So this becomes more of a residential program that is shorter than kind of the year-long residential program. So the difference being, when you're in a 7-day hospital stay, I always found this interesting when we had Philbrook Center, there was always this push that kids needed to be in school while they were in treatment. And no one, under no other circumstances, if a child had appendicitis or meningitis or something, would you expect them to do their schoolwork? But for some reason, in the mental health world, we felt that kids needed to complete their schoolwork while they were under treatment. And if they're only there for 7 days, they really need to focus on recovery and getting better, not on schoolwork. So the PRTF, so acute care beds allow the kids to focus on feeling better and getting help. The PRTF combines that acute mental health care, but then also wraps the schoolwork in it because it's longer term.
Great, thank you. I know we have another question in the chat, but before we go to that, how about a timeline on the forensic hospital that you mentioned? I know that's
So I'm hoping that we are going to be breaking ground in the spring of next year. That is the goal. So right now we are doing our community forums where we have an architect that is designing the building. We'll be bringing that back out to the community. We want input from that, but hoping that we're breaking ground spring of next year and that we will be in by the end of 2024.
Great, great. And then we did have a question in the chat asking about what does the future, what does telehealth look like in the future here in our state?
I think it looks good. I think we learned a lot of lessons during COVID-19 and where it's beneficial to use telehealth, especially in rural areas and people that have a hard time accessing in-person care. I've said this before and no one will be surprised. I'm so worried about too much of a good thing. I believe the foundation of mental health treatment is in that therapeutic relationship, and I think it's difficult to do that over a screen. But I do see use and I do see the benefit of it, but I don't want to swing that pendulum all the way that everything goes to telehealth. I do think that there is a benefit to in-person treatment, but I do think it looks good for not just New Hampshire, but across the country. Telehealth is here to stay.
Great. I have a question for you. I don't see any others right now. Folks, put them in the Q&A if you have them. I loved your talking about language and discriminatory language and how we need to avoid it. I also want to give you kudos for having brought up the SLAP heard across the country, because I think that's a space that has been a fraught space for white folks to wade into. So kudos for your bravery in doing that. And I think it was, yeah, it was a traumatic event in multiple levels.
It was a traumatic event. And like I said, within 24 hours, my Facebook feed was filled with memes of that slap. And, I try to put myself in the position of Chris Rock or Will Smith. And it was such a traumatic event and people are poking fun at it. And as a mental health professional, I didn't see a slap. I saw a traumatic event, and I saw a shattered spirit. And the outrage came from the perceived joking about Will Smith's wife's alopecia, right? But without the realization of what that event was, which was trauma for both parties and probably a lot of people watching. So, it really resonated with me that our entertainment industry was taking the opportunity to use that event as something for their next stand-up or their next skit. And I just think we need to be more cautious about how we characterize things like that, because what it is trauma.
And then in your experience, because I think so often we're faced with folks who use language, to talking about things being crazy or nuts or those kinds of things. How do you find for yourself the best way to respond to that? Because often it comes from folks that are our allies, right?
Yeah, no ill intent,
Right.
intent, just part of our language and our culture. So oftentimes I'll restate it in a way that's less discriminatory. So not in an obvious way where I'm correcting them, but when I am talking to them, and if they're talking about that event, I will restate it and use words that are non-discriminatory and non-biased. So that's typically what I do when I feel like I have to go in that direction. And it's subtle, but I think it gets the point across.
That's great advice for us all. I don't see any more questions. I think there's more coming through in the chat, and I think folks are, recognizing that how traumatic this has been for Chris Rock's family to see this slap played over and over again. I think that's a good point. But I did also want to point out that earlier in the chat, someone did say, Lori, you are inspirational and a rock star. Thank you for what you're doing for New Hampshire. And I think those are wonderful words that we all echo. Thank you so much for joining us today.
Yeah,
we really appreciate you making the time. And thank you for all the great work. New Hampshire is very lucky to have you.
Great. I'm sure I will see you all soon. Yes. Stay safe, stay healthy.
You too. Thank you.
Have a great conference.
Thanks. Oh, did we miss some chat, or people's hopefully saying thank you? All right.
We do have another chat on the Whova platform. There were no questions there, but lots of comments are also coming in about their gratitude for the commissioner's remarks. I did keep an eye on it just to make sure that there were not any questions there, but just really saying that her words of hope resonate with folks and that they are just in agreement with her message.
Yeah, no, she's been a great choice in commissioner for us, and I think and obviously we've all seen it's been a very difficult job to step into at this particular time. I will say I think she's seen more camera time than any other commissioner in my history and working in New Hampshire. So I think, look back at our schedule, it's me, yes? All right, so I want to really welcome folks. I am going to share my screen. I do have some slides, just sort of the prompt, sort of my updates here as we move forward with today. Let me make sure I'm sharing the right screen with you and not like my inbox. You'd probably prefer not to see that. It's a little traumatizing, frankly. Here we go. So I think most folks here are part of the NAMI New Hampshire family. So just want to again, thank you all, because hope does start with you. I do want to give a huge shout out here to our sponsors. We are really lucky to have those sponsors who have made it possible for us to bring this conference to you and provide some of the incentives that we've had and make sure that this conference is accessible to everyone by not having to charge for it. So really grateful to our sponsors and to folks who donate to NAMI New Hampshire to make this happen, as well as our funders. I want to thank each of you for attending. I know we have a lot of folks who registered for the conference over these 2 days, so really grateful to you for taking the time to be with us. and recognizing it is during a weekday. So really hope that you will have the opportunity to learn from this conference. And also, I know over on the Whova platform, there's a lot of great connections happening and networking. So really thrilled about that. I've had a lot of folks reach out to me via LinkedIn. Happy to connect with folks. Feel free to do that. I'm guessing because some of them I think maybe folks who registered for the conference. So continue the networking after this, but we're really thrilled to see that happening, especially since we can't all be together. I also want to just in this moment, because I know we have healthcare providers who have joined us, and we all know that the past couple of years, and I'm going to talk a little bit about COVID-19 and its impact on mental health. And the last 2 years have been exceptionally challenging for all of us. Great segue really with the commissioner talking about traumatic events. We have all been really going through this collective trauma as we've navigated the pandemic. And our mental health care workers have been going through that same collective trauma with us, yet they are still there caring for us, our loved ones. And we are so profoundly grateful, recognizing that we need you more than ever before. And you are being faced with a need, the demand for your services like nothing before, and yet are also having to go through this challenging time. So really kudos to our mental health care workers and thank you. And I would be very remiss if I did not say thank you to our amazing NAMI New Hampshire family, our staff, and most especially our volunteers. I'm going to talk a little bit about some of the work that we've been doing that has continued right through COVID and even expanded. And honestly, that would not have been possible. The level of services provided would not have been possible without our amazing volunteers. And those volunteers also, had to pivot on a dime 2 years ago to providing services on virtual platforms. And they all stepped up to the challenge, and it has been, really a really good reminder about how much we all need each other in order to navigate difficult times and just life. So you're probably familiar with this 1 in 5 adults in the United States experience mental health challenges in any given year. That's 1 in 5 pre-COVID. Through COVID, we are seeing 4 in 10 adults reporting symptoms of depression and anxiety, and increased numbers of youth and kiddos, and also our young adults in experiencing mental health challenges. Last year, we shared this slide with you. The bar on the left shows what the reports were for adults in terms of symptoms of anxiety disorder and or depressive disorder. That was prior to COVID, and that was about 11% of the adults in the survey. In early 2021, that had increased to 41%. These are just recent March numbers. We do see a bit of a decline, but we're still at 31%. That's a pretty significant increase pre-pandemic. We know folks are still really struggling. This slide just gives you sort of a quick, and this too is a very, very recent data, a quick snapshot. We continue to see that in terms of age groups, while everyone is affected with negative impacts from COVID-19, that we see our young folks, young adults being particularly impacted. And it's interesting to me that you see on this slide that mental health is the first negative impact from COVID over the other items. The other thing that we are seeing with COVID, and I don't know that this is a real surprise for folks, but we see that folks with lower to middle incomes tend to find more negative impacts on their mental health, their physical health, than folks in the higher income brackets. I don't think we'd be really surprised at that, but it does speak to folks who may have more difficulty accessing services or having adequate health insurance coverage, are struggling more than folks who perhaps have a better safety net. No surprise here at all, I think, on this slide. When people cite the reason for these negative changes, the first one is that isolation and not being able to see people. Even though we are, even though perhaps not all of us are extroverts, the reality is we are social beings, even in the most introverted amongst us. It still requires usually some sort of social interaction to be healthy. And so the isolation caused by the pandemic has been profound. I also want to, harken back to the slide looking at how this has had such a significant impact on young folks and young adults and versus older folks. Some of that may very well be because older folks were already pretty isolated. So while it doesn't necessarily mean they are less impacted by COVID-19, the isolation was not necessarily a new thing for them, but it's still a negative. We also see in this recent research that's study that's been done, or survey, my term's correct, that the impact upon mental health, about half folks say that that it's had a negative impact. I think when you look at this chart, what's really interesting to me as folks start rating where these impacts come in, first is the kids' education. And I think we've seen the struggles for kids with having to pivot between remote schooling and in-person, and the challenges, of course, particularly last year with trying to make in-person learning happen. And I know we're seeing a generation of kiddos who have lost some ground in terms of their educational achievements, and are going to require some additional assistance to catch up. But then the second, the biggest impact here is children's mental health. I'm going to talk a little bit about that in the limited time we have today. And then, of course, mental health, and then finding physical health and the other issues below there. What's interesting to me is I was trying to get some data, because one of the things that we hear all the time at NAMI New Hampshire, and I see myself with trying to assist folks, that my loved ones, with finding care. It's very difficult right now to access a provider. And with COVID, a lot of what we're hearing is just plain, it's, providers saying, I can't put you on a wait list because I don't know how long it'll even be before I can get you in. And folks calling, getting a list of providers from insurance companies and calling every one of them and finding them not taking new patients, for example. So we're still hearing a lot of that and seeing a lot of that. Interestingly, though, this data is pre-pandemic, and actually shows that the provider, finding a provider and the cost were the biggest, difficulties in accessing services, and we expect that that will continue in additional data. I always want to offer up some hope. As the commissioner said, this is a conference about hope, and NAMI New Hampshire is about hope. I think there are some silver linings that we've seen, and I'll touch on some of them. But I think, interestingly, the survey did find that one of the positives of the pandemic included spending more time with family. So I think for all of us to try and, hold on to that, and, are there ways that we can continue to emphasize that as we start to come out of this pandemic mode. So the commissioner made reference to her hope, one of her hopes, which was that no one would have to wait overnight in an emergency department for a hospital inpatient bed or a designated receiving facility bed. That's what DRF stands for. And this is a chart that you may be familiar with from NAMI New Hampshire in the past. We have we've often provided this chart when we do presentations. We've been tracking this data now in this manner, as you can see, since 2015. The ED boarding crisis, as we call it, has been going on for over 9 years, though. We started tracking this data in 2015. And if you look along here, this data goes through March of this year. You'll see down here, we give a point where, oh, there's my cursor. And this was just where the numbers hit 0 for basically 24 hours when COVID hit. And then we continue to see this steady increase in that really peaked. The dark blue line is kids, by the way, the light blue line is adults. So I think what we've seen post-COVID, if you compare that dark blue line in this section versus back here, we're definitely seeing it in terms of kiddos and their need for an inpatient bed. And we did see a little bit of a drop in the fall, but then our numbers are back up. And indeed this morning, or I think it was yesterday, we had 26 kiddos boarding in emergency departments and 18 adults. It just gives you another longer snapshot of this, which also points out this, I want to point out this number here, which is, although we have 26 kiddos waiting right now, the highest point we have been at was Valentine's Day of 2021 with 51 kiddos boarding in emergency departments. I recently was interviewed by someone about the ED boarding situation, and at that day the number of children waiting was 23, and I had to stop myself for a moment, and because of this 51 number, and thinking, I thought to myself before the interview, well, it's not as bad as it's been, but then I thought, but it's 23 kids and they're probably all waiting for a week to 2 weeks in emergency departments. So I think, you know, we still have a tremendous crisis on our hand, and that's a tremendously traumatic experience for these kids and their families, and it's just not okay. So another slide you've probably seen at NAMI New Hampshire conferences, looking at leading causes of death here in New Hampshire. This is data through 2020, which shows that suicide, those green boxes, remains the second leading cause of death for those aged 10 to 34. And then it's the third leading cause of death for those between 35 and 44. We do have some data from January of 2022. And I think this is something that's really important for us, for those of us who care about kiddos and their mental health, to be mindful of. Because you'll see that, yes, the COVID-19 as a cause of death, where it really starts to tick up there is when you get into the 25 to 45-year-olds, and then of course your 45-year-olds and above. But what this is really concerning about is how many of those folks are primary caregivers or parents of children, and what is that impact on those children in losing their caregivers. Indeed, we've seen in the last 6 months, the American Psychological Association, the American Academy of Pediatrics, and the US Surgeon General have all declared that our youth are facing a mental health emergency. And just in the past week, the CDC warned of, and this is just a headline from the APA, but of this accelerating mental health crisis among adolescents, with more than 4 in 10 teens reporting they feel persistently sad or hopeless, and 1 in 5 saying they have contemplated suicide. So we know that we have a lot of work to do as we continue to navigate our way through the effects of the pandemic. And one of those is to pay really close attention to the needs of our kids and how we can best address them. Here in New Hampshire, NAMI New Hampshire is part of the Children's System of Care, also called a Fast Forward program. And as part of that, it's a high fidelity wraparound model. And as part of that, NAMI New Hampshire provides family peer support. And that is just what it says. These are folks who have experience with raising children with serious emotional disturbance, other mental health challenges, who then are providing peer support to other families who are going through the same thing now. In February of 2020, so these are pre-pandemic numbers, we had 175 families, and we're averaging about 1,300 contacts with those families each month. Early this year, we were at about 450 families with 3,900 contacts per month. So just there, we're seeing a huge number of increase of folks, kids needing these services through the Fast Forward program and other wraparound services, and their families needing support. This statistic I have at the bottom here, I did want to share with you, and it harkens back to the previous slide. The Office of Child Advocate here in New Hampshire, when they issued their annual report, which went through June of 2021, estimated that 161 children in New Hampshire had experienced the death of a primary caregiver due to COVID-19. So those COVID deaths have a significant impact on kids. We're all very grateful that kids are less likely to have severe illness if they contract COVID, but the impact for them in losing their caregivers and their long-term mental health is profound. So we do have some real hopeful things happening here in the state. The commissioner really nicely teed this up. In January 1st, New Hampshire launched its Rapid Response Access Point along with statewide mobile crisis. Prior to that, if you remember, there was just mobile crisis in Greater Nashua, Greater Manchester, and Greater Concord areas. Now there is access statewide. The Rapid Response Access Point it went live on January 1st. We've got now, there's a scrub data from the department showing the data for January. And you can see there that it had a pretty robust opening with over 1,500 contacts, and that there were 427 mobile deployments. This is just in January, and that about a little over 18% of the folks were that they received calls about were for folks, kiddos under age 18. The remainder being, of course, for adults. And then those also interesting, they broke down the mobile crisis deployments as well to show us that 121 of those mobile crisis deployments were for youth and 306 were for adults. I will, at the end of this, be able to share the slide. I would tell you too that we have a great presentation coming up with the folks from the New Hampshire Rapid Response Access Point during the conference, so please check that out. There's also a webinar on our onwardnh.org site that we recently had around the Rapid Response Access Point. There are a lot of great webinars on there. So please, check that out. But this is really a transformational moment for us in New Hampshire to have this opportunity to have a single point where someone calls when they're experiencing a mental health crisis to seek care. And as the commissioner said, this will help prepare us for the rollout of that 988 number that will roll out nationwide and go live in July. And so New Hampshire will have in place the Rapid Response Access Point will be able to field those calls, as well as mobile crisis as part of the array to respond. We all know we need a whole lot more in terms of a robust community mental health system response, and there's still work for us to do, but this is really an exciting moment and truly a transformational one. I think so many families, our struggle has always been, right, when we feel that we need to call for assistance, that call has typically been a 911 call, and the response has typically been a law enforcement response. And that has sometimes tragic outcomes, and it also is very often not the response that folks most need, because when you have a mental health crisis, you really need a mental health response. So last year, NAMI New Hampshire served more folks than we'd ever served before, some 40,000. And, that's a significant increase for us over the previous year. And again, this is something that we could not have done without our amazing volunteers. There is no way we could have stepped up and responded to this level of need without all of our volunteers. We are so incredibly grateful to you. part of what we've done as an organization and trying to respond to some of the increased needs and then that we have seen over the last couple of years. When we saw the kids numbers just spiking so in emergency departments, we created these RAC cards. So what you're seeing is two sides, a two-sided card. And these are resources for families who have kiddos waiting in emergency departments. These have gone out to all 26 critical access hospitals, to their emergency departments, to the community mental health centers, emergency services, getting ready to send out another round of them. We also have them for family members and adults who are waiting in emergency departments. There is a page on our website if folks are interested in looking there, where we also try and make sure there are resources for folks who are boarding in emergency departments or have a loved one boarding in emergency departments. So these, both of these cards went to all 26 critical access hospitals, to their emergency and nursing staff and the community mental health centers. We also created this, again, it's a RAC card. You're seeing the two sides laid out next to each other. Again, NAMI New Hampshire doesn't provide clinical services, but we do provide really important support and education and of course advocacy. One of the things that we wanted to do was try and get the word out to folks who, because there's been such long waits for folks to even get initial appointments when they're seeking care, outpatient appointments, we wanted to let folks know that there are places to go for support while you're waiting, that we can't provide the clinical care, but a family could certainly access support through one of our family support groups, or a parent to one of our parent and caregiver support groups, or a peer through one of our peer connection support groups. We also have a number of closed Facebook support groups, which if I have time, I'll reference later. And then of course our education programs and advocacy. These are all our free services because we wanted to make sure that we were promoting everything that would be accessible to anyone who might be in need. NAMI New Hampshire has just in this year enacted a new strategic plan. The board adopted a new strategic plan. It goes into far more depth than this, but I wanted to give you a quick snapshot of those strategic plan goals. We heard loud and clear from folks, continue to advocate and be that voice for people with mental illness. And so NAMI New Hampshire is continuing that advocacy role and advocating for systems change and holding systems accountable. And then continue to update our educational and support programming, sort of our bread and butter, those core signature programs that make NAMI NAMI, to make sure that they are up to date, and expand them where it's necessary, and really work on how we can expand access to those. The board also felt it was really important for us to take a hard look at NAMI New Hampshire and do some work around incorporating diversity, equity, and inclusion principles into our work. We know that New Hampshire is becoming more diverse. We especially know it is for our youth. Our youth are a much more diverse population than, shall we say, New Hampshire Granite Staters of my age tend to be. And we recognize that we need to make sure that as an organization that was founded in an effort to make sure folks living with severe mental illness could live a full life in their communities and be included and feel like they belong, that we still have work to do to make sure that everyone in New Hampshire feels like they are included and belong here at NAMI New Hampshire and can access feel comfortable accessing our services. So part of, another piece that we have developed in the last year has been cards, these just sort of informational cards directing folks. We do have a website page for resources for LGBTQI+ folks. And we wanted to make sure that we had something that we could offer up to people specific to that. So we developed this piece of collateral. And similarly, In our work, doing our DEI work, we realized that we needed to make sure that one, we were calling out systemic racism and working to eradicate the racial inequality that exists in terms of mental health and accessing mental health services here in New Hampshire. And so we developed, we have a website page developed to resources for the Black, Indigenous, and other people of colors and the Asian American, Pacific and Islander communities. And so that we could develop this card as well. As I talk about these materials, please, please let us know. We're happy to share them. And if you think of someone that we need to get them out to, we're happy to do so. I think most of you are probably familiar with. These are our education programs that we offer around the state. The commissioner mentioned our crisis intervention team program, which is training for law enforcement, 40 hours of training for law enforcement, and is considered the gold standard for training law enforcement around interacting with folks with mental illness. Have one of those happening next week and pretty much every month of this year, which is, it's great. I think we all know that law enforcement does interact with our loved ones, and making sure that that response is one that's informed and appropriate to someone in a mental health crisis, while also ensuring public safety is really important. We continue with our advocacy efforts. They have been largely all online. And as have most of our education programs. A couple of things like CIT have to be done in person, but most of our education programs we were able to pivot to be offering online, virtually. And similarly, our support groups, we have support groups for various groups of folks. Cannot thank our support group facilitators enough for how quickly they pivoted to offering these groups in the virtual realm. We are really hopeful some of these groups will be able to start meeting in person. We also recognize some of these groups are probably going to continue to be virtual, which has a real bonus. Indeed, some folks are able to access it who weren't otherwise able to do so. Of course, there are those folks that it's a challenge to access virtually. So our ideal world will be a mix so that we can ensure access for everyone to critical supports. I mentioned earlier the Facebook support groups and our one-on-one supports, our information and resource line. You can find all this on our website. Do want to mention NAMI New Hampshire is a has been deemed a veteran-friendly business, and we're thrilled with that. NAMI National offers their NAMI Homefront program for families of military and veteran families online. We have a Facebook support group. On here, there's a mention of the COVID Coach app from the VA. I want to give a huge shout out to the VA App Store. First of all, it's all free. Your tax dollars, please go in there and check it out. They have some great apps for around managing mental health, depression and such. And then this COVID Coach app is great. And of course, the Veterans Crisis Line is an important resource for veterans who are experiencing mental health crises. Can't thank you all enough. We've had 2 virtual walks. Didn't think we could ever pull off a virtual walk. We've done it twice now, and they keep getting bigger and bigger. And indeed, our 2021 walk topped the previous one and was the highest grossing walk that we've ever had at over $200,000. We are super hopeful that we are going to be able to have an in-person walk this year on October 8th. And then also offer up a virtual event for folks who can't get there in person on the following day. So we'll still be able to share all those pictures online. Thank you all for coming out, participating, for donating, and especially sharing your pictures and flooding social media with those pictures of you stomping out stigma. I would surely be called out if I did not tell you all to save the date. We are coming up on our 40th anniversary celebration. For our annual meeting this year will be on June 16th. It is currently planned to be in person at the Manchester Country Club with a live stream option. So please, yeah, everyone can participate and view it, but so don't feel, if you're not comfortable with an in-person event, don't feel that you can't be part of it. Stay tuned for more information on that as we get a little closer to the date. And just those crisis resources, I want to particularly call out on here, the rapid response access point number there, the 833-710-6477. And you can also text and chat with them. The website is nh988.com. And then, of course, crisis text line, the National Suicide Prevention Lifeline, Trevor Project, all continue to provide those important crisis resources. So I do just want to end, one of the things that I reflect upon frequently in my role here at NAMI New Hampshire, and my previous role as Deputy Director at NAMI New Hampshire, has always been what we call the NAMI New Hampshire family, which is an enormous family. It is not just the staff, it is not just the 200 plus volunteers, it is really all of our supporters, our members, and those folks who reach out to us. Once basically, once you've contacted us, you can pretty much figure that we're going to count you amongst the NAMI New Hampshire family. But I think these last couple of years have really brought home how important those relationships are. And this quote from Gwendolyn Brooks is something that I actually keep on my phone in a little sticky note widget to remind me all the time that we are each other's harvest, we are each other's business, we are each other's magnitude and bond, and that we really do not, we really cannot, succeed alone, that it does take all of our collective effort to help us realize those collective hopes that the Commissioner talked about. So I'm not sure, I'm gonna stop sharing, and I'm not sure if there were any questions, but I think I'm at time, so.
So there is one question so far, and it was regarding your boarding slide, Susan. Can people be considered waiting for a space boarding and go home while waiting?
So that's a great question. And it's going to depend on how you're waiting. So once you leave, you're no longer waiting. So you're not waiting, you would no longer be in what they call the queue, the list. But sometimes people are, if they're not being involuntarily admitted, may be able to leave the emergency department and don't have to stay there. There are some inpatient beds in the state that are voluntary, so it may be possible through a private provider for someone to access those. They are slim and hard to find, and oftentimes if folks who are in the emergency department are willing to take them, that's where they'll be diverted to. Kiddos tend to be more apt to be. I recently saw something that approximately 50% of the kids who board in emergency departments are actually being discharged, having other being discharged to in other ways versus inpatient. Have to look a little more into that data. Came out of the Office of the Child Advocate. So the reality is, if you want to be on the list, you're going to be boarding in an emergency department most likely, unless you have a provider who's able to work with you. But it doesn't mean for everyone that once you enter the door, you're not leaving the emergency department. If you're deemed to be a danger to yourself or others, then it's unlikely you're going to be leaving in the near term without some sort of intervention or a new assessment that deems that you're safe to do so.
Okay. So I do not have any other questions that are in the chat or in the Q&A right now. I think just folks are weighing in and saying great data. Thank you very much. Thank you for your leadership, Susan. Thank you to NAMI New Hampshire. We've got a lot of kudos for sure. So that I think is really it, unless anybody has any other questions. Let's just check over on the Whova app. Oh, okay, hold on. On the Whova app, people are just weighing in. There's some things just sharing the resources that you shared are being shared over on the app, some links and things of that nature. So let's see. Thank you all so much, Susan, and thank you to all of NAMI New Hampshire. So at this point, we do have so thank you so much, Susan, for your message. At this point, we'd like to share the former KID governor, Charlie Olson's message with our Navi, New Hampshire community. Emily, can you share that message, please? Oh, okay.
Today, I'm going to talk to you about stigma. A stigma is when people look at you negatively because there's something different about you. Sometimes people who struggle with depression can feel embarrassed or ashamed because they think they're different. You may fall and skin your knee and you have no problem telling your teacher that your knee hurts, but if you're extremely sad and suffering mentally, you might avoid talking about it because of the stigma. Hi, my name is Charlie Olson and I'm the 2021 New Hampshire KID Governor. I'm so excited to be this year's KID keynote speaker for this amazing event. Welcome everyone to the NAMI New Hampshire Annual Conference. KID Governor is a civics education program that gives kids like me a voice to make a difference. I live in Auburn, New Hampshire, and I love my town. I love our great state of New Hampshire, and I've been honored to represent the children of this state. I was so excited to be the New Hampshire KID Governor, but the reason I ran is because I want to help kids who may be suffering from depression. I'm so fortunate to have this opportunity to speak up and help kids that are struggling with depression, anxiety, and other mental illnesses. I've been blessed with an amazing team of teachers and administrators at Auburn Village School. My teachers presented me with this challenge and gave me a voice to speak up and help kids that are struggling with depression, and I am so grateful. I want to be able to help kids learn how to hold on to hope and learn that when they are struggling with mental illness, there is always someone available to help and that they don't have to do this alone. My journey with KID Governor began with a personal narrative that I wrote in my language arts class at the same time that the KID Governor program was being introduced in social studies. That's where my platform was born. So, what do I have to be depressed about? I'm a straight-A student. I play several sports like soccer, baseball, golf, skiing, and I compete in triathlons. I have a supporting loving family and 2 sweet golden retrievers, Lazy Hank and Spunky Lola. I have a brilliant rock star sister who is a gymnast and will be a heart surgeon someday. My mom is an elementary school teacher and she has stayed home to take care of me and my sister. My dad's pretty amazing. He's my biggest fan and supporter. I have tons of friends at school and beyond. My parents always said I was the happiest person they ever met in their life. Some would say I have the perfect life, and I do. But in mid-March 2020, all of that changed. My world and the rest of the world's lives changed in a big way. We began the COVID lockdowns and we were separated and isolated from our friends. My perfect life didn't look perfect to me anymore, and I struggled with loneliness and fear that came with the quarantine orders. My doctor diagnosed me with situational depression. You might be wondering what depression feels like to a kid like me. When my mom would tuck me in at night, I would cry myself to sleep. I couldn't eat because I constantly had stomach aches. Turns out these were caused by the mind-body connections tied into my depression and anxiety. My joints ached for no physical reason. I was constantly stressed and worried about absolutely everything, including what school would look like last year and whether we would survive COVID or not. There is hope. If we can help kids understand what depression feels like, they can talk to a trusted adult, a counselor, or a coach who can help them, or maybe they can even talk to a friend if they're feeling down. I want kids to know that they don't have to do this alone. By talking with a close friend, I was able to hold on to hope and get through my depression. Before the pandemic, approximately 3 million kids were diagnosed with depression in the US. This number does not even include the kids that have gone undiagnosed. During the pandemic, children and adults have been struggling, and this number has gotten so much bigger. I want to raise awareness of this important issue. I want to get kids the help and support that they need. Kids have been isolated from their friends. Kids are social beings. These kids that are suffering look just like me and my friends. They may look happy and perfect on the outside, but on the inside, the struggle is real. As KID Governor, I had a chance to speak to so many kids across the state. I would tell them these things to help them hold on to hope when they are struggling. If you're having trouble sleeping at night, you don't have to be afraid to talk about it. If you don't understand why you're not feeling quite like yourself, you don't have to be afraid to talk about it. If you're feeling sad and lonely, you don't have to do this alone. If you're suddenly feeling physical pain for unknown reasons, you don't have to do this alone. If you feel like you're the only person that's struggling, you don't have to do this alone. And if you feel like things are hopeless, you don't have to do this alone. It can be a friend, a teacher, a coach, a family member, or a counselor that can be there to help a kid hold on to hope when they're struggling. I've been spending my time as kid governor spreading the word and trying to eliminate the stigma associated with mental health struggles. I've spoken in many groups and created materials to support kids that are suffering. Along with the Kid Governor program, I've created videos to be shared in all 5th grade classrooms throughout the state. I ran a poster contest to raise awareness of where kids can turn when they are feeling down. These posters will be hanging in most schools around the state. While I'm here today to speak to you about childhood depression, I'm also here to ask for your help. We need to open up discussions and make sure students feel safe and confident to share how they are feeling. My 5th grade teacher, Mrs. Cohen, created the true feeling of family in her classroom. It made my classmates and me feel connected in that we belong together. Through things like daily class meetings, we all felt very comfortable sharing how we were feeling. Mrs. Cohen, by the way, was a finalist for the 2022 New Hampshire Teacher of the Year. This year, like most students in our state, I'm in school full-time in person, which feels great. My 6th grade teachers are also amazing, but that fear of the pandemic and what may still happen is very real. The worries about needing to quarantine again or to go remote learning are still there. The fear of getting sick or losing a family member still linger. I've learned through talking with many of the children that the most important thing a trusted adult can do is listen. Don't try to fix the problem right away. Don't just reassure us that everything will be fine, because to us it isn't. Just let us know that you are there. And of course, steer us towards any additional support we may need. I will tell you a few things we have accomplished this year. At the end of May, I've teamed up with Chief Justice John Broderick as presenters of the Magnify Voices Expressive Arts Contest award ceremony at Tupelo Music Hall in Derry. Man, that's a mouthful. We were also two of the judges for the middle school entries. The kids that entered did some amazing work. There's a huge range of entries from essays, poems, songs, drawings, and paintings. On June 16th, I spoke at the New Hampshire Association of School Principals annual meeting. It was a great opportunity to remind our school leaders to make mental health a top priority. I also spoke to all of the New Hampshire school superintendents at the Grapponi Center in September. They were so supportive of my platform, and the standing ovation was pretty cool too. One of my favorite opportunities this summer was speaking to a group from Plymouth State University at the governor's residence in Concord. I was invited by New Hampshire's First Lady, Valerie Sununu, to share my experience with childhood and mental health at a meeting about the Choose Well program. It was very exciting to be part of something so important. My family and I even took a tour of the Bridges House and learned about its history with Mrs. Sununu. This fall, I continued my partnership with the Choose Love Foundation, touring the state with the Choose Love RV and crew, spreading the word about this important program. We made stops in Keene, Plymouth, Littleton, Manchester, and Nashua. Another huge honor last year was being the kid keynote speaker for the International NAMI-Con. We worked throughout the month of June and the beginning of July with a film crew to create a piece to be aired on July 27th. It was cool to be part of such an amazing event. In September, Reach One, Teach One, Love One featured me on their website for Mental Health Awareness Month. In October, I was able to kick off the 5K race in Exeter that was organized by Connors Climb.
I'm gonna let Charlie kick it off. Charlie Olson, did y'all know we have a kid governor? He's what I have dreamt of for all these past 10 years. I won't forget you. I know you're trying. A young person who talks about mental health, because your brain is the same as your arm or your leg. You know, it's the same as physical health. But I know you're so strong. Oh my God, I know you're strong.
My name is Charlie Olson. She mentioned it. I am the New Hampshire's Kid Governor. And I ran on a platform of childhood depression. My goal is to eliminate the stigma associated with it. So people are afraid to talk about it because they think they're different. And my goal is to get rid of that. That shouldn't be a thing. We're all here for different reasons, but we're all here for the same cause.
I'll be standing right there beside you, even if the walls start to cave, I'll never let you go.
Which to me is very important. Who's ready to start this race? I think we can do better than that. Let's hear it. I think we can do better.
We were able to raise more than $6,000 for suicide prevention. We are sticking it to stigma. In October, I got to speak to the Governor's Executive Council at the New Hampshire Institute of Politics. You might have seen it on the news, but that was the day the radical protesters disrupted the meeting, and we had to be escorted out by state troopers, and everyone was running around the room, and it was crazy. I was still able to give my speech, but boy, was that bananas. It was a tough situation to be in, and I didn't expect that kind of welcoming committee that day, but I learned a lot, and in the end, I felt like I was a part of history. One thing I learned from that is that sometimes you need to put your head down and persevere as kid governor, and I'm glad I had that experience. I'm so thankful for Neil Ovechkin and Cayman for including me in so many events at the Institute of Politics. I received a huge honor on October 27th. I was presented with the Eric Cogwell Memorial Award by the Seacoast Mental Health Center. The award is presented annually to recognize an individual for their outstanding contributions to help improve the lives of people with bipolar disorder and other mental illnesses. The recipient provides hope, education, or support for those living with mental illness, as well as those who care for them and or contribute to the community at large in New Hampshire. We can make the world a better place for kids. We can live happier lives and eliminate the stigma associated with mental health challenges. Our future is a world we get to create together. Join me in making the world a place that is free of the stigma associated with mental health struggles. Thank you for listening to an 11-year-old boy like me, and enjoy the rest of the conference. And remember to hold on to hope. Thank you.
So we did get some comments saying what a remarkable young man. He is very impressive for sure. And very inspiring from other people's comments. Susan, I know we will be asked this, so I will ask it here. May we have a copy of your slides? I know there was some really important information that folks will be interested in having. So we can get a copy of those slides and put it on the Whova platform for folks to be able to get the information and connect with some of those resources.
Yes, absolutely.
Okay. Well, our next session, we will see you back here at noon. Our next session, the keynote presentation, is scheduled at noontime. So just as a reminder, folks, we will have an evaluation that will be emailed to you at the end of the day. There is an evaluation for each of the days. So at the end of day 1 and at the end of day 2, there will be an evaluation in which you can give us comments on the sessions and comments on the conference overall. And we really do utilize that feedback, so we appreciate you taking the time to complete the survey. The session, as you know, will be recorded, and it was recorded, and it will be available on the Whova app for 30 days, and then it will be available on the NAMI New Hampshire YouTube channel. I see lots of chat that's happening on the Whova platform. There are also the community boards, so you continue the conversation over there. And as we mentioned, the next session is at noon, navigating amidst overwhelming times, and we will see you back then. Thank you all and see you at noon.